Hello Level 4s, it's Earl here. Just wanted to welcome you and well done on getting into the sports science area and in particular the clinical pathway that you're now on. By now you may have met me in the induction week, but I really wanted to just give you some insight into se4107, the first aid, biomechanics and anatomy module, which is a core module that you do within the first year. The short clip is really to explain what to expect, how you can already get ahead of the game and talk you through how the module is being assessed. Once again, before we even go into the content based, I want to assure you of my constant support during the year. We also have fantastic mentors, peer mentors. Those are second year students who have just finished this module a year ago, and they are really a good part and a good asset to have in terms of helping you achieve. So please actively make use of the mentors. They can give you some helpful pointers, tell you how they went about their study, and give it to you from a student point of view. So the module itself starts out, within the first 3 weeks, we explore first aid. Very important skills to gain. Now some of you may have already completed a first aid at work award, that's great. So this module, if you want to achieve your first aid award, there is a fee attached and we'll discuss that within the first class, but within week 3 an external company comes in to assess you on first aid. If all of you need to pass that, whether you're going for an external award or not, but in order to complete the module you have to pass the first aid component. Remember that having your first aid award makes you employable, because we constantly will ask you and regularly ask you to help us out by providing first aid at sports events, so you can really start using your skills early on in the course. After the first aid component is completed, that's roughly by week 3, we then start discussing and exploring anatomy. Now anatomy, we teach that as an art, as a language, understanding the terminology, understanding how we relate different body parts and how we explore the body in terms of the way it moves. So we start out by exploring the terms, then we look at planes and joints and how joints move. We consider what bone is, we look at cells, we look at tissue, we look at organs. And then for the bulk of the first term, which is up until the Christmas break, we will look at the lower limbs. So really exploring ankle and foot, knee, and then hip. And what you will be learning then is how to identify the different bones, how to palpate them, how to feel them, how to identify the different features on the bones, looking at how the joints are formed, how bones articulate or move in order to produce motion. We'll look at how joints are strengthened or how joints become more stable by exploring ligaments. Then we'll look at the muscles. We'll be able to consider and test the strength of muscles. We also test the angles of joints using a piece of equipment called a goniometer, which looks like 2 rulers which are being joined, and looking at what active, when the patient actually moves, and passive, when you help the patient move that joint to the end of the range. And then we'll look at what happens in terms of considering the change in range. So that's the important part. We then will also consider the blood supply and the nerve supply to the lower limb, from the hip all the way down. We also have some exciting guest speakers who will be coming in to tell you about their field of practice, and that can help you better understand where you're moving to as you go from first year, second year into your final year, and then into the real world when you step into the world of practice at the end. So anatomy is not only a module. Think of anatomy as a very important thread that weaves its way right through your course of study. If you know your anatomy, you're going to be able to master other areas relatively well. If you fail to learn your anatomy, you may struggle as you get into second and final year. So the first term is really about the lower limb. At the end of the first term, we visit an anatomy lab where you will get the opportunity to view what we call a prosection. So it's a human body that has been dissected into parts, and you'll get an opportunity to actually work with a limb looking at the anatomy in a complete way and really being able to feel, palpate, view and explore how the body comes together, which will help you make better sense of all the components that we've learned. Then in the second half of the year, we carry on the theme. We explore the front of the body, the chest and abdominal part, the vertebral column, spinal cord and muscle culture of the back, and then we predominantly focus on the upper limb from shoulder, elbow, hand and wrist, following the same way. This module is then assessed in 4 ways. The first component that is assessed is the first aid, which is simply a pass or fail. If you don't pass on first attempt, don't panic, you'll get an opportunity to retake that, and that's just pass or fail. All of you have to pass that component in order to complete the module. Then the second component for assessment is what we call an OSCE, which is an observed and a structured clinical examination, and that will be just after the Christmas break, early January, for the lower limb. You'll be asked to come into the anatomy room and you'll be asked to classify a joint, point out different bones, point out different bony markings, point them out on a bony model that we'll be using in a class, on a live model, your patient, and also on a film, so we'll show you an X-ray of a joint. Then we'll ask you about different ligaments, and you'll have to show us where they run to and from, even test them. You'll have to test the range using that piece of equipment we call the goniometer. And then you'll also be asked questions about muscles, where they start, where they end, what they do, how do we test the strength of those muscles. We'll also then give you an applied case. So we'll say, for example, a tennis player is executing a backhand. Tell us what's happening at the elbow and the hand and wrist. And you'll need to consider which muscles are working in order to bring about this type of motion. And then we will also grade you on your ability to provide us with additional facts, things that you've picked up outside of the course, things that you may have picked up through your reading, things that you may have picked up when you go to the anatomy lab for the visits, as well as how you have handled and managed the patient through the clinical examination itself. So we will talk a lot more about that. You will all have the opportunity to do thorough practice exams before we enter you into the final exam. So you'll do an OSCE for the lower limb. You will also do an OSCE for the upper limb. The 2 OSCEs constitute 80% of your grade, so they are really important, 40% each. And then the final 20% is a workbook, and I'll be talking you through that within the first class. This is an ongoing account of your learning, and we'll also be explaining to you the software and the packages that we use to help you learn and build a portfolio of your learning. So that will all be explained within the first week. This video is just really an outline of what to expect on the module. Attend class on time. Don't just attend. Make sure you do the pre-reading. We use a site called Moodle. All your lecture notes, all the material that is required will be on there at least 4 days before the class. Make sure you go on, you check what's online, you're constantly reading so you come to class ready. Because the whole aim of doing well, and all of you can do well if you apply yourself in an effective way, is doing the reading, staying on top of the work, and making sure you're asking questions to clarify your understanding. Don't be scared to ask. Don't be scared if you're struggling and you've got a lot going on. Come and see me or come and see another staff member. Go to your personal tutor as well. Make use of us. We're here to help you. We're here to support you. We're here to ensure that you do the very best that you can. Our mentors are here as well. And maybe some of you, when you get through your first year, may consider becoming a mentor to new students who will enter the next academic year. So please keep your mind and eyes open to the fact of becoming a mentor. It's the most fantastic, rewarding experience that you will have. Finally, what's left for me to say, enjoy the year. It's a fantastic year. Students who have gone through it, we use hands-on approaches. So we're going to do body art, body painting, Koki pens, building models, using, for example, latex gloves that you'll draw on to understand the anatomy of the hand and wrist. So we really try and engage it as opposed to just lecturing you. It's interactive, it's engaging, and you need to invest your effort and time to get the most out of it. I wish you luck. Please come and see me if you have any issues, and I'm really looking forward to working with you all during this year. I hope you have a fantastic experience and good luck with your first year.